Well, we know that lifestyles are underpinning some of the chronic diseases that are facing us in the health service. And we know that in Wales we need to do an awful lot more to adopt healthy lifestyles. So this is a fantastic initiative to encourage NHS staff, like other people in Wales, to really get behind adopting a healthy lifestyle.
I think fitness has always been my drug. I've never really done normal drugs. I've never smoked because it's just illogical. And I've never been a massive boozer, and I learned quite early, because I used to swim as a kid with City of Cardiff Swimming Club, that you get a massive buzz from feeling fit. So I can see the advantage for NHS staff trying to get involved and do it for themselves, really.
Well, we all know when we go training, it can be hard. So you want to make sure you get the right feel to get the most out of your efforts, really, and it's what I do as my profession. So I'm hoping I can pass on some of my advice, which will hopefully help everyone who signed up to the scheme, and that they'll get the exercise bug and they'll feel better for it.
I think it's really great for NHS staff to lead the way, and it's great, for NHS staff to be able to motivate the rest of the population.
People sort of talk about the endorphin buzz you get after it, but actually just being out in the fresh air and having sunlight on your skin when we have sunshine just lifts your spirits. And so actually I'm already feeling that that's a nice thing to be, is outside listening to the birds, and if it's a nice day, just enjoying the weather.
I think it's important to have a target, and that's why this is a great scheme, because you'll really be able to day in, day out, that's when you see, am I doing my best? It's okay on day one being highly motivated, but to do your best, you've got to be persistent, keep at it. But the time to be motivated is when you've been training for a few weeks, or you've been exercising for a few weeks, and the weather's cold outside, it's dark, you've had a long day at work. Now that's where the motivation comes in. I
used to keep a little exercise diary of swim sessions that I used to do, and then times within those swim sessions that I would be achieving, so then you have got a point of reference. So that's a brilliant starting point, because then fairly quickly, again, the advantage of starting from a habit of not having done a hell of a lot is that your progress will be really quick. So you'll probably have a fairly vertical improvement in your fitness level. So it's lovely to be able to back ref what you used to be like, and then kind of give yourself a little mini pat on the back, because you are doing well in comparison to where you were.
There's always areas we can improve, and I think the more we can be there to help our patients to make lifestyle changes, the better we'll all feel, and the better the health of the population will be.
There's nothing like the confidence that comes from feeling good about yourself, the confidence to raise health and lifestyle issues with patients, and I think the confidence to show that you actually have done it, and will be full of tips and ideas about what worked for you. So I think it's a fantastic way of people demonstrating that they're role models for change, and that these changes can be positive and can be done.
I think it's important as a healthcare professional, particularly working in pre-assessment, that I'm actually a really good role model for my patients. I'm 52 next year, and I think my joints are starting to ache, and I think the only way that I'm going to improve my joint health is by taking a couple of supplements, by exercising, and by keeping my weight down. So I really want to improve my health, but to be a wonderful role model for my patients in pre-assessment.
Enjoy it. Set yourself short, medium and long-term goals. Keep the progression, and I wish everyone the best of success, really, and get in touch by Twitter or Facebook if you ever need any help or ideas about sessions. I'm always here to help.